Dear friends, we will continue our unit number 3, diagnostic method used for urine analysis. Last time we have seen that analysis of blood gives the diagnosis of various diseases like anemia or malaria, or we can say typhoid, and likewise infection or abnormalities. Now we will see the diagnostic method used to observe the urine analysis. So urine is a liquid byproduct of the body secreted by the kidneys, and it gives secretes by kidneys by ultrafiltration method, and it gives uh, the total contents. It gives the idea of the content, either normal or abnormal. So contents are urea, creatinine, uric acid, then trace amount of enzymes, carbohydrates, hormones, fatty acids, pigments, and mucins. So as usual, we know that if your urine contains carbohydrate or sugar more, we can call it as a diabetic patient. So likewise, there are so many diseases that can be identified by the urine analysis. Or we can say the contents of the urine contains sodium, chloride, then magnesium, calcium, ammonium sulfates, then urea. Some contents are normal, but some are not normal, some are abnormal. If they are appearing in the urine in maximum amount, then definitely the person is suffering from the disease or abnormality. So physical characteristics of the urine is to be studied from its color, which is reddish or yellow or amber color. If reddish urine is due to the ingestion of naturally colored foods, then green, brown, or deep yellow color may be uh, because of bile pigments, appears in generally liver disease. Then in fever, the urine may be dark yellow or brownish. Then blood or hemoglobin develops smoky to red color. So dark brown color appears due to metho to, due to methemoglobin and homogeneic acid. So homogeneic acid, if appears in the blood, the dark brown color of the urine appears. And in green color, methylene blue gives the urine a green appearance, and the urine is transparent. So turbidity is developed in alkaline urine by precipitation of calcium phosphates. So these are some symptoms. Then while a normal adult excretes daily 1200 ml to 1400 ml of urine. The kidneys must produce a minimum urine volume of about 500 ml per day to rid the body of waste. Otherwise, the waste will reside or make a residue in your kidney or body, and urine stone may appear. So excessive urine production is polyuria, and dehydration or renal disease appeared below the output of the normal level, called as oliguria. So these are the abnormalities found in the patient if the urine is not properly secreted. Then the diuretic action of tea, coffee, coca is due to the caffeine, and the decreased volume of urine in hot weather is due to an increased loss of water by perspiration. So these are the reasons that urine can give you the idea of your physiology of the body. So normal urine appears transparent and water-like. Urine pH is slightly variable due to nature of the diet, either 5.5 to 7.5, and average is 6. So this 6 is the normal pH of the urine. But it may appear from 4 to 6, 4.6 to 8.0 in some samples. The urine becomes alkaline on standing due to conversion of urea to ammonia and loss of CO2 to air. Then the acidity of urine is increased after strenuous muscular exercise. Then specific gravity is 1.005 to 1.050. So this is the basic arrangement of the urine or normal arrangement of the urine, and the order of the urine in normally aromatic, but it is modified as the ingestion of different fruits or drugs or anything what you intake as a food material. Then normal constituent of urine includes urea. This is the nitrogenous constituent, and urea is the main end product of the catabolism of the protein in mammals. It consists of 80 to 90% of the total urinary nitrogen. In fever or diabetes or excess adrenocortical activity, urea excretion is increased due to increased protein catabolism, and decreased urea excretion is due to decreased urea production. So this is a fatal liver disease. In acidosis, there is decreased urea excretion. Second is ammonia. Ammonia is formed by the kidney from glutamine or amino acid in acidosis. In chronic intestinal nephritis, the specific gravity is lowered and the specific gravity is increased in the excretion of abnormal substances such as albumin or glucose. Its odor is fresh urine aromatic, that we have already studied. Now creatinine and creatine, these are the another constituent. So creatinine is excreted by children and pregnant women and much smaller amount in men. So excretion in men is about 6%, whereas creatinine is formed from creatine. It is excreted in relatively constant amounts regardless of the diet. The creatinine coefficient is due to the creatinine coefficient is the ratio between the amount of creatinine excreted in 24 hours and the body weight in kilogram, and it usually appears in 20 to 26 milligram per kilogram of the body per day in a normal man, and 14 to 22 in normal woman. So man and woman ratio is quite changed. So creatinine excretion is decreased in many pathological conditions, and creatinine excretion is also found in pathological states such as starvation, hyperthyroidism, then carbohydrate metabolism impairment, and likewise. So creatinine excretion is decreased in hypothyroidism. So next content is uric acid. It is also a natural product of the oxidation of the purines of the body. Then it is slightly soluble in water, and its excretion increased in leukemia or in a liver disease. Then the concentrated urine on cooling forms a brick red deposit which is mainly acid urate. So it creates a pain to the urinate. So pure uric acid is colorless, and its specificity of the analysis of urine is increased by treatment with uricase, the enzyme which converts uric acid to allantoin. Next content is amino acid. It is about 150 to 200 milligram of the amino acid nitrogen. It is excreted in the urine of adults in 24 hours. In infants, it excretes about 3 milligram, and up to the age of 6 months, it reaches to 1 milligram per pound. Then the low excretion of amino acid nitrogen is due to its high renal threshold value. An increased amount of amino acids are excreted in liver disease and in certain types of poisoning. In cystinuria, 4 amino acid arginine, cysteine, lysine, and ornithine are excreted in urine. So these are the amino acid status. So allantoin is the partial oxidative product of uric acid. Small quantities of the allantoins are excreted in human urine. The other subprimate mammals, allantoin, the principal end product of purine metabolism, is excreted. Next is the sulfate. The urine sulfur is derived from sulfur containing amino acid such as methionine and cysteine, and therefore its output varies with protein intake. So urine sulfur exists in 3 forms: inorganic sulfur, It is completely oxidized sulfur precipitated from urine. Then ethanol sulfur, it is about 10% of the total excretion, and it consists of or includes the combination of sulfur excreted in the urine. It consists of sulfuric esters of certain phenols, and it forms no precipitation. Clinically, the eternal sulfate is the indoxyl indican, which is formed from bacterial decomposition. Normally 5 to 20 milligram of indicantor excreted, and the amount increased in constipation or in cholera, typhoid, gangrene, lungs, etc. So next topic will be studied in the next speech. We will concise our speech here.